everybody, Alba Hatcher, trainer in pink here. I wanted to take a moment to talk to you about the most common cause of knee pain. So this is typically somebody that will describe their pain towards the outside of their knee. A lot of times people say that they have a tight IT band. Remember that you actually cannot have a tight IT band. Your IT band can pull the weight of an 18-wheeler truck and never give way or fray at all. All right, so it's actually muscle imbalances and fascia that have limited movement in certain areas, as well as cause movement that's not supposed to be there. So I borrowed one of Frank's legs here. All right, so you have, this is the femur, this is the tibia, this is the patella. We're gonna keep it really simple and just use those three, okay? So, so what happens here is that when muscles here on the outside get tight, all right, so that tight IT band, the muscles around it are feeling that tension also, you better believe it. And the fascia around it, which is just connective tissue, can also get dense. So what happens there is that the patella will come out of alignment. So this leg is meant to be shown hanging, so it's not gonna be perfectly in line as I'm holding it. But this right here is your patella. So what happens is this bone wants to track in your femur. So if you're looking at the underside, you can see that there's a groove that takes place. All right, the same groove is there in the front. But what happens is those muscles and the fascia, the connective tissue is so tight that it's pulling the patella off track. And so when that patella is off track, you literally have bone compressing on bone. Now, articular cartilage, which is just the smooth lining, okay, it's just the smooth lining of the bone, eventually loses its integrity. It's just wear and tear that happens, but that patella doesn't have to be off track. And then that's why people will use massage therapy or a foam roller to relax and break up that fascia a little bit so that the patella can come back into alignment and it can groove easily again. So if you guys have further questions on how to address it, how to take care of it, there's a lot of stretches and exercises you can do to correct this type of muscular imbalance. But hopefully you guys find that helpful, having a visual demonstration of what's going on with that injury, and hopefully it's helpful. I love you guys, and I'll talk to you soon. Bye.